The process of drugs release post-parenteral administration and medical devices used in parenteral dosage form. In this video, we are going to continue the discussion of parenteral dosage form. In the previous video, we have learned about the type of pharmaceutical dosage form used in parenteral drug administration. In this video, we will focus on discussing the process of drug release after administered parenterally and medical devices needed during the process of drug administration. Parenteral drugs can be given through several routes of administration. However, in this video, we will discuss about 4 routes that are commonly used by general practitioners, such as intradermal or intracutaneous injection, intravenous injection, subcutaneous injection, and intramuscular injection. Let's start with intradermal or intracutaneous injection. There are 4 layers of the body barrier: epidermis, dermis, subcutaneous tissue, and muscle. As reflected by its name, intradermal injections are administered into the dermis, just below the epidermis. An intracutaneous or intradermal injection is given at a 5 to 15-degree angle. The advantages of this route are that the body reaction is easy to visualize, and the degree of reaction can be assessed because once this injection is completed, a bleb or small blister should appear under the skin. Absorption is low, but this is good for testing allergy. The entry into the general circulation is limited mainly by the rate of blood flow to the site of injection. This injection route gives the longest absorption time of all parenteral routes. This site tends to be used mostly for local effects, such as local anesthesia, sensitivity tests, such as tuberculin or allergy tests. The most common sites used for intradermal injection are upper chest, the inner surface of the forearm, and the upper back, under the scapula. Intracutaneous injection is usually given with a small size syringe, such as syringe 1 ml with 26 or 27 gauge needle. Next is subcutaneous injection. This route of injection is used to deliver a small volume of medication, less than 1 ml, into the subcutaneous tissue. The drug needs to be injected into the fatty tissue just below the skin. The injection is given at 45 degrees when using a long needle or 90 degrees when using a shorter needle such as an insulin pen. The most common sites for subcutaneous injection are abdomen, upper outer arm, and anterior thigh. Absorption of drug through this route may have longer duration of action because they can be given as depot formulations, where the drug is released over a long period of time. Subcutaneous injection is usually given with a small size syringe, such as syringe 1 ml with 23 or 25 gauge needle, or a pre-filled multi-dose pen, such as an insulin pen. Next, we will discuss about intramuscular injection. Muscle tissue has a greater blood supply than the area just under the skin, including subcutaneous tissue. It also holds a larger volume of medication than subcutaneous tissue. An intramuscular injection is given at a 90-degree angle. Similar with subcutaneous injection, absorption of drug through this route may have a longer duration of action because they can be given as depot formulations, and thus are not metabolized quickly. However, intramuscular injections are absorbed faster than subcutaneous injection. That is due to muscle tissue has a greater blood supply than subcutaneous tissue. Intramuscular injection is usually given with syringe 3 ml or 5 ml, depends on the volume of the drug, with 20 or 25 gauge needle. Next, let's discuss about intravenous injection. This type of injection is injected directly into a peripheral or central vein of the circulatory system. It's usually given at a 25-degree angle. IV route is the faster route of drug administration. Intravenous administration can be given into two different ways: bolus and infusion. When a drug is given all at once or over a short period of time, it's called bolus administration. On the other hand, if the drug is given into a vein over hours or days, it's called infusion. There are two types of infusions: intermittent infusion and continuous infusion. Intermittent infusion is given over longer than 5 minutes but less than 24 hours. The infusion may be repeated over a period of days. Large volumes, for example 250 until 1000 ml, or small volume infusions, for example 50 ml, may be delivered continuously. Drug can be delivered as bolus through IV canal. The other bolus method is a direct injection into the vein. However, this method is rarely given for therapy. Usually, it's performed for taking blood sample from vein or venipuncture. Bolus injection can also be given in the condition when patient has been receiving other solution or drug infusion. For example, giving a bolus of anticonvulsant into patient who has been receiving isotonic liquid infusion. This bolus injection is given through a device called three-way stopcock. The three-way stopcock has 3 connected tubes. Each tube can work as inlet or outlet. The device used in the illustration has 3 pointing parts and a blunt part. The one that is different from the other, which in here is the blunt part, works as a stopper. It closes the access of fluid from the inlet below the blunt part. Therefore, if we direct the stopper or blunt part downward or facing the finger, it will stop the fluid flow from the infusion bottle. This will let the drug in the syringe to go directly into the vein as a bolus injection. Please make sure you do it correctly, as if you do it to the other way around. The drug will go to the infusion bottle. Infusion set is most commonly used to administer fluids from an intravenous container by gravity. In general, the basic components of an IV infusion set contains spike, which punctures into a sterile bottle containing an IV solution, drip chamber, micron filter, long sterile tube, flow controller, connector covered with a protector hub. There are 3 types of infusion set called pediatric infusion set or microdrip, adult infusion set or macrodrip, and blood infusion set. Pediatric or microdrip infusion set delivers a small quantity of each drop. It has a microdrip inside its chamber. 1 ml of liquid is equal with 60 drops. This infusion set is used for pediatric patients or a specific adult patient population who require a small, closely regulated dose of IV solution. Adult or macrodrip infusion set delivers large quantities of IV solution. It delivers at faster rates than microdrip set as it passes a larger quantity of fluid with each drop. 1 ml of liquid is equal with 20 drops. Blood infusion set is a device used for blood transfusion. Blood components must be filtered during transfusion to remove clots and small clumps that form during collection and storage. 1 ml of liquid is equal with 15 until 20 drops. Cannula is a tube that can be inserted into the body, often used for delivering fluid. IV cannula connects the infusion set and the vessels. Cannulae normally come with a trocar attached, which allows puncturing of the body in order to get into the intended space. Once the trocar is removed, cannulae becomes a flexible tubes. Different cannula size are indicated by different colors. This table shows the color coding of IV cannulas along with the gauge size and maximal flow rate. This color coding make them easier to differentiate, especially in emergency situations in which size might be critical. In addition to infusion set, we can also deliver IV infusion through a medical device called infusion pump. It delivers fluids in a controlled rate and volume. We need to put a 25 or 50 ml syringe into the infusion pump and connect the syringe into the patient's vein through a long tube called syringe pump extension set. This extension set should be pre-filled with isotonic liquid or drug before connected into the patient's vein. Wing needle or butterfly needle is used for venipuncture, especially for a very superficial veins, such as hand or scalp vein. It consists of hypodermic needle, wings, flexible transparent tubing, often 20 until 35 cm long, and a connector. The connector attached to another device such as syringe and vacuum tube. When compared to a simple straight needle, butterfly needle can sit on more body surface, therefore tolerates more patient movement. Okay, this is the end of the video. Hope you enjoyed this video and understand the topic better than before. See you!